Hello, my name is Dr. Thomas Nabity. I'm a physical medicine and rehabilitation as well as a pain medicine specialist. Today we'll be talking about utilizing compounded pain medications into a cream or other form in the management of pain. The goal of today's lecture is to introduce you to topics and terms that will commonly be discussed when selling compounded pain medications. In order to do so, we will be introducing you to the idea of pain, why it is there, typical treatments for pain, how compounding medications fits into the treatment of pain, how the pain cream or compounded medication works, some available studies to discuss, introduction to the types of specialists that may utilize the medication, as well as some frequently asked questions. The Webster's type definition of pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. The key component to this definition is that it's an individual experience, not only associated with the unpleasant sensation, but the unpleasant emotions that those sensations elicit. Pain is the most common reason for physician consultation in the United States. It is a major symptom in many medical conditions and can significantly interfere with a person's quality of life and general functioning. Pain can cause unwanted feelings such as depression, frustration, resentment, and stress. Pain can be categorized into different types. Specifically, neuropathic pain describes that damage or disease that affects the nervous system. Nociceptive pain is that caused by tissue damage, such as muscle tissue damage when pulling a muscle, or skin tissue damage when suffering a burn. Acute pain is a protective normal response to a traumatic event, such as a trauma or surgery. It can also be defined in a time frame of that being less than 3 or 6 months. While chronic pain is a persistence of symptoms, which is abnormal. Even though the tissue has healed, the pain persists, and it provides no protective function. Two common sources of pain are joint pain, and that is pain which comes from any joint. A joint is a point where any two bones meet. Joint pain can also sometimes be called arthritis or arthralgia. A second term, musculoskeletal pain, is a more generalized term to describe any pain that comes from muscles, ligaments, tendons, or bone. Joint pain would be a type of musculoskeletal pain, but musculoskeletal pain would also involve muscle tissue, which can be damaged with the wear and tear of daily activities. It can also include trauma to any area, such as a jerking movement, auto accident, fracture, fall, sprain, dislocation, or direct blows to the muscle. And all of these can cause musculoskeletal pain. Other examples of pain of the more chronic variety include fibromyalgia, a chronic disorder characterized by widespread musculoskeletal pain, as well as fatigue and tenderness in classical locations of the shoulder and pelvic regions. Osteoarthritis is a chronic joint pain condition characterized by degeneration of joint cartilage and the underlying bone, which most commonly forms in the middle age and onward. It causes pain and stiffness, especially involving the major joints of the lower extremity, such as the hip, knee, and the thumb joint of the upper extremity. Neuropathy, or neuropathic pain, is a chronic pain disorder which occurs due to nerve damage from diseases such as diabetes or exposure to toxins and drugs such as chemotherapy when treating cancer. Typically, this pain is described as a burning or sharp stabbing pain located in the feet or hands in a stocking glove distribution. When discussing pain with physicians, it is often helpful to understand their perspective. A physician typically addresses pain in a three-step process. Step 1 is defining the source of pain, or finding the pain generator. This will include obtaining a detailed history, including reviewing previous testing and treatments, and ordering any necessary diagnostics, such as labs, x-rays, ultrasound, CT, or MRI. The next step would be defining the patient's dysfunction and limitation, as pain is often not curable, but manageable, and the dysfunction is the limitation which causes the patient the most distress. Pain elimination is often not possible. The third step is to determine the correct combination of pain treatments. The typical treatments used for pain can include activity modification, that is, stopping the offending activities or modifying them, bracing, using options such as knee braces, ankle braces, abdominal binders to help brace or support the affected area, therapeutic exercise to strengthen muscles, stretch muscles, and restore balance to the patient, medication treatments, both by pill form or, in our case, topically applied pain creams, therapies, both physical therapy as well as psychological counseling, modalities, which are ways of delivering heat or ice to the affected area, injectable medications, and surgical options. Due to limitations many people have with pills, which include side effects or difficulty swallowing, pharmacy compounding can provide alternative methods of delivery to make the process easier. Instead of a capsule or a tablet, pain medications often can be compounded as dosage forms such as a topical gel, cream, or roll-on form that can be applied directly to the site of pain and absorbed through the skin, a custom flavored troche that dissolves under the tongue, a nasal spray, or a suppository. These dosage forms are better able to target the pain source and bypass other organ systems, leading to less gastrointestinal irritation as well as limited risk for cognitive effects of liver or kidney damage. And the alternative delivery forms also prevent patients who have difficulty swallowing pills, removing yet another source of aggravation. Another important reason to consider compounding medications is that many chronic pain sufferers are placed on a variety of medications to help address the symptoms associated with their condition. That is, most patients are treated with multiple pills. On many occasions, multiple medications can be combined into a single dose of a specifically prepared compound that combines the medications into a single capsule, or topical preparation, providing greater convenience for the patient and, very importantly, less potential for interactions and side effects. Because patients vary in size, symptoms, and tolerance, Commercially available medications sometimes may not provide the appropriate dose strength for an individual patient. Through compounding, a prescriber and pharmacist can customize the dosage to the exact amount the patient requires and find a dosage form that best suits the patient's needs. Pain can be debilitating, whether it's acute muscle or nerve pain resulting from an accident, or a more chronic condition such as arthritis or fibromyalgia. Pharmacy compounding may help improve a patient's quality of life by providing relief with potentially fewer side effects and less overall medication. In summary, physicians should consider compounding topical formulations to be a first-line treatment for pain medications that work at the site of pain due to the limited risk of side effects when compared to their oral alternatives. For pain generators located in deep tissues where topical applications may have limited ability to penetrate, oral medications or targeted injections are more likely to be effective. However, given the low risk for side effects, a trial of topically compounded cream is still reasonable and should be strongly considered. Now more about how the pain cream works. Each compound starts with a base cream. Our base cream is Lipoderm Active Max. It has been proven to deliver up to 4 drugs simultaneously through human skin in vitro, which means in a living organism. Lipoderm also was tested for allergic reactions with no adverse reactions reported in an extensive 2-month study. The active ingredients added to the base cream can be any medication upon the physician's request. Most commonly, these include ketamine, a nerve pain medication, diclofenac, an anti-inflammatory musculoskeletal pain medication, baclofen, a muscle relaxer, gabapentin, a seizure medication, again used to treat nerve pain, bupivacaine or lidocaine, which is a numbing agent used for any type of pain. Many, many more. The percentages can vary and can be changed based on the physician's specific recommendation. Many physicians will want evidence-based medicine or a list of studies that can prove the claims that the active materials are indeed delivered through the skin. This is a list of studies that has proven various active ingredients or pill form medications when crushed and mixed with Lipoderm Active Max, showing its ability to deliver the active ingredient through the skin.
Another great feature of our compounded pain cream is the cost to the patient. On average, the out-of-pocket cost to the patient is only $10 to $40. If for some reason the patient's insurance doesn't cover the medicine, the pharmacy can attempt an alternative medicine called a therapeutic interchange. This interchange makes the cost to the patient much less, and an uninsured patient will pay no more than $30 for the alternative medication.
This slide represents a list of example types of physicians who are more likely to utilize pain creams, but by no means is an exhaustive list, as all physicians encounter patients who could benefit from this therapy. However, orthopedics or orthopedic surgeons, pain management clinics, which includes multiple specialties, but that treat patients complaining of chronic pain disorders, sports medicine clinics, which focus on patients suffering from sports injuries, physical medicine and rehabilitation specialists, neurologists, podiatrists, as well as physicians who specialize in treating patients who have become addicted to narcotic pain medications, as these patients are seeking alternative methods for prescribing pain medicines rather than narcotics. Also not listed are primary care physicians who also are often reluctant to utilize narcotic pain medications and are seeking alternative methods. Some frequently asked questions you are likely to encounter are: is compounding legal? And the answer to this is absolutely. Compounds must be prepared by a certified compound pharmacy, which is regulated by the state boards. Along those lines, the question, is it FDA regulated? The answer to this question is a little more complex. Yes, the medications that are the active ingredients as well as the base creams are FDA regulated. However, the combination of the medications in their specific percentages is not an FDA regulated activity, as that particular cream is created for only that particular patient. Instead, the FDA chooses to let compound pharmacies be regulated by their individual state boards. Additional frequently asked questions you are likely to encounter: is the pain cream covered by insurance? Most major commercial insurance plans, including Medicare plans, cover compounding. If the particular plan does not, the maximum charge for the pharmacy will be $60 for a supply that will last at least 1 month, depending on the patient's frequency of use. How does a doctor order it for a patient? We have created convenient order forms with our most common diagnosis-specific creams pre-written. These forms can be faxed to our pharmacy after a doctor has chosen a medication and signed the form. How does my patient receive the medication? The pain cream will arrive in the mail at the patient's home within 1 week from the date ordered. This concludes our sales affiliate training slide session. Thank you for your attention.